sir.
Pangmalakasan tong narrative nila Hina ah.
Oo nga, sir. Pa-next na pat, wag yan.
Ha? Game.
Ito na, sir. Sir, yung napunta po sa akin, lung cancer, sir.
Ay, wait lang pala, wait lang. Can someone record it? Baka kasi mamaya biglang mawala yung internet. Hindi ko masundan yung pinagsimulan natin. Please record it ha. And from this day on, every time na mag-meet tayo, please record it for our personal consumption lang. Our usage. Okay? Thank you. Sige na, start na sino nga tong batang to?
Christian.
Alice Sinulin.
So, yan, sir, lung cancer. Lung cancer is cancer kasi kaya nga lung cancer siya. Cancer siya. That forms in tissues of the lung, usually in the cells that line the air passages. It is the leading cause of cancer death in both men and women po. So, pa-next pat. So, sir, ayun po yung nilagay ni Eunice yung example ng healthy lungs versus unhealthy lungs po. Ayan po, yung healthy lung, syempre, yung nasa kaliwa po. Yan, tapos, two main categories po ng small cell carcinoma. The most aggressive form of lung cancer, it usually starts in the bronchi and then affects the whole lung. These cancer cells are small and are considered to be quite aggressive in nature and they have a large growth factors. Yeah. Next po. Yan. Tapos ang isa pa po ay non-small cell carcinoma. Is any type of epithelial lung cancer other than small cell lung cancer. It usually grows and spreads more slowly than small cell lung cancer. It is also the type of lung cancer that has the best prognosis. Ayan po yung three types ng non-small cell cancer. Cell cancer, non-small cell cancer yan. Squamous cell carcinomas, adenocarcinoma, large cell carcinomas. Yan po yung three types niya po. Next part. Yan. Yung squamous cell carcinoma po ay moderate to poor differentiation, makes up 30 to 40% of all lung cancers. More common in males, most occur centrally in the large bronchi. Uncommon metastasis that is slow affects the liver, adrenal glands, and lymph nodes. Yan. Associated with smoking. Yan. Then, not easily visualized on X-ray. Pa-next pat. Yan. Yung adenocarcinoma naman, increasing in frequency, most common type of lung cancer, 40% to 50% of all lying cancers. Yan. Clearly defined peripheral lesions, glandular appearance under a microscope, easily seen on a chest X-ray, can occur in non-smokers, slow metastatic in nature. Yan. Large cell carcinoma makes up 15 to 20% of all lung cancers. Poorly differentiated cells tends to occur in the outer part of lung, invading subsegmental bronchi or larger airways. Metastasis is slow. Early metastasis occurs to kidney, liver, organs as well as the adrenal glands. Yan po. Ang origin siguro dito siya natuklasan. Sa Germany, 1929, causative agent po niya ay carcinogenesis. Si Genesis pala to. Next pat. Yan. Yung mga predisposing factor po, sir, ay genetics, yung age, yung gender, family history, comorbidities tulad po ng tuberculosis, pulmonary fibrosis, tsaka COPD po. Then precipitating factors, asbestos, air pollution, ionizing radiation, tapos exposure to radon gas, exposure to harmful chemicals, perpetuating factors ay smoking tobacco and secondhand smoke po. Ayan, yung signs and symptoms po niya, madadaanan din naman ito mamaya dun sa pato. Yan, ayang Yung signs and symptoms niya, cough, fever, dyspnea, chest discomfort, pleural effusion, hemoptysis, voice hoarseness, arm, shoulder, neck pain, face and arm edema, muscle weakness, and finger clubbings. Ayan po. Tapos yung mga laboratory findings po na nakalagay dito, hypercalcemia, hyponatremia, hyperglycemia, and severe hypokalemia. Mamaya po madadaanan po yan sa pathophysiology po. Ayan. Tapos yung mga yung mga diagnostic po, para dito pa sa lung cancer po, yung X-ray po, reveal the condition of the lungs, can detect cancer po 'yon. Tapos yung cancer daw po, pag po ang nag-a-appear siya sa X-ray as white gray mass po yung itsura niya po pag yung lung cancer po. Next pa. Tapos yung kasunod pong diagnostic ay CT scan, most likely to show lung tumors than routine chest X-ray. It can also show the shape, size, and position of any lung tumors and can help find enlarged lymph nodes that might contain cancer. Yan. Pa-next po. Ay, next ulit pa. Ganun din yan eh. Yan. Yung kasunod po, sir, bronchoscopy. Yung bronchoscopy po, provide a way for the doctor to view the tumor, assess the extent of the airway obstruction, and collect a tissue sample for analysis. Yun po, yun sir, parang may pinapasok na camera to sir eh. Yung bronchoscope po ata yun. Pa-next pat. Ayan, tapos sumunod po, thoracentesis, procedure in which a needle or small tube is used to remove excess fluid in the pleural space between lungs and the chest wall. So, ayan po yun. Pa-next pat. Ayan, fine needle aspiration. So, say parang din po, dito po sir, a sample tissue is removed from the lungs to examine it. Parang biopsy, ganun, may kukunin kang sample. Ay, biopsy nga siya. Parang biopsy. Yan, pa-next pat. And endobronchial ultrasound. Parang same ng bronchoscopy to sir. Parang may pinapasok na po, camera po. Ganun din po yung Pa-next pat. Yeah, surgical lang biopsy yun. May kinukuhang sample din para ma-test for para ma-assess yung kung may cancer cells dun sa tissue. Yan, pa-next pat. Yan, yung mga biomarkers testing sa una po, yung EGFR or yung dito po detects the presence of mutations in the EGFR gene in the DNA of the tumor cells to help determine whether someone with non-small cell lung cancer may benefit from targeted therapy with tyrosine kinase inhibitors. Tapos sumunod po dun sa LAK testing or yung anaplasmic lymphoma receptor tyrosine kinase gene. This detects a specific rearrangement in the ALK gene in cancer cells and tissue. Presence of these changes makes it more likely that a person with non-small cell lung cancer will respond to a targeted drug therapy. Tapos yung kasunod po, proteomic testing, proposed as a blood-based predictive and prognosis test for individuals with non-small cell lung cancer who test negative for EGFR mutation and for individuals who have not responded to first-line therapies. Tapos sumunod po yung sa cross mutation analysis, usually ordered in non-small cell lung cancer. If the tissue from cancer contains a cross mutation, then you will not benefit from EGFR targeted therapies. Pa-next pa. Shit, ang init. And yung mga medications po na ginagamit, yung sa non-small cell, gumagamit ng 2-drug regimen, cis/carboplatin plus 1 other yun. Yung mga ginagamit po yung Taxol, gemcitabine, tapos sa small cell, cisplatin, tsaka etoposide. Other drugs, paclitaxel, cyclophosphamide, doxorubicin, tsaka vinblastine. Yan yung mga ginagamit. Usually, ito yung mga ginagamit para atakihin yung cancer cells or yung mga cells na nakakatulong para sa production tsaka sa survival ng mga cancer cells. Yun yung kalimitang inaatake nila. Yan, pa-next pat. Yan, surgical treatments po, yung surgery, yun, pwedeng i-remove yung mismong tumor or parang may nakita ko ni-remove na yung part nung lungs na may tumor po, ayun. Para maiwasan na daw po yung pagkalat. Tapos radiotherapy uses pulses of radiation to destroy cancer cells. Tapos sa chemotherapy po, uses combination of drugs, kaya siya tinawag na chemo kasi may ginagamit yung chemicals yun po. Then, immunotherapy, it works by helping the body immune system to recognize and destroy cells po. Tapos sa targeted therapy, used to treat non-small cell lung cancer, use drugs that target specific genes and proteins that are involved in the growth and survival of cancer cells. Ayun po. Pa-next. And sa nursing management na po. Yun. Assessment, subjective data, ay yan. Past health history, exposure to smoke, airborne carcinogens, and respiratory diseases and pollutants. Nutritional habits, yan. Signs and symptoms. Objective data, vitals monitoring, tapos respiratory, assess for wheezing, stridor, hoarseness, pleural effusion. CBS, assess for cardiac tamponade, dysrhythmias, pericardial effusion. Yan, findings such as X-ray, MRI, CT scan, CBC. Next pa. Yan, diagnosis po, acute pain related to presence of chest tubes or surgical incisions. Impaired gas exchange related to altered oxygen supply. Ineffective airway clearance related to obstruction caused by secretions or tumor. Planning. Yan. Siyempre, report pain, relieve or control. Demonstrate improved ventilation and adequate oxygenation of tissues by ABG within patient's normal range. Demonstrate patent airway with fluid secretion easily expectorated, clear breath, sounds, and noiseless respirations. Yan. Intervention sa acute pain. Ask client about pain, determine pain location and characteristic. For example, continuous aching, stabbing, or burning. Have client rate intensity on a scale. Yan, yun nga po yung sa 1 to 10 po ata. Yun. Then, helpful in evaluating cancer-related pain symptoms which may involve viscera, nerve, or bone tissue. Use of rating skills aids client in assessing level of pain and provides tool for evaluating effectiveness of analgesics, enhancing client control of pain. Yung intervention naman po sa impaired gas exchange, note respiratory rate, depth, and ease of respiration. Observe for the use of accessory muscles, pursed lips, breathing, changes in skin or mucous membrane color. Yung rationale po niya, respiration may be increased as a result of pain or as an initial compensatory mechanism to accommodate for loss of lung tissue, increased work of breathing, and cyanosis may indicate increasing oxygen consumption and energy expenditures and reduce respiratory reserve. Ayun, ineffective airway clearance naman po, elevate the head of the bed to ease the work of breathing and prevent fluid collection in upper body. Auscultate chest for character of breath sounds and presence of secretion. Noisy respiration, rhonchi, and wheezes are indicative of retained secretions and or airway obstruction. Evaluation, patient was able to report that pain is relieved. Patient was able to demonstrate improved ventilation and adequate oxygenation of tissues by ABGs within within patient's normal range. Patient's breathing pattern became more regular, and upon auscultation, abnormal breath sounds are no longer audible. Pathopatient na po. Game next pa. Gamitin ko to. Yan sir, dito sa sa lung cancer po, yun, uncontrolled, mag-umpisa po sa uncontrolled abnormal cell growth in one or both lungs. Yan yung pinakataas. Then, umpisa po tayo dito sa kaliwa, sa local tumor growth. Then, pag nagkaroon po ng local tumor growth, magkakaroon po ng obstruction of proximal airway. Then, that will result to inability to clear inhaled pathogens. Yon. That will result to post-obstructive pneumonia. Then, yun yung magiging cause kung bakit ka merong cough, fever, and dyspnea. Then, dito naman ay merong, pag nagkaroon ng obstruction or compression at local site, syempre, meron kang obstruction, magkakaroon ng increased effort to ventilate the lungs. Kasi mayroon ka ngayong nakabara, meron kang harang. So, hindi makapasok ng ayos yung hangin. So, magkakaroon ng increased effort to ventilate the lungs. Yun. Tapos, meron ka ngayong dyspnea or shortness of breath. Tapos, pag nagkaroon naman ng compression at the laryngeal nerve, alam naman natin na yung larynx yung responsible para yun sa boses natin. So pag nagkaroon ng compression dun sa nerve na yon, magkakaroon ka ngayon ng impaired innervation to the vocal cords that will result to voice hoarseness. Hoarseness yon. Then, pag nagkaroon ka naman ng compression dahil dun sa tumor, nagkaroon ka ng compression dun sa yung brachial nerve plexus. Yung brachial nerve plexus is a network of nerves that send signals from spinal cord to your shoulder, arms, and hand yung nakalagay dito. So, dahil nga nagkaroon ka ng compression doon sa nerve na yon, magre-result yon ng arm, shoulder, and neck pain. So, pag naman nagkaroon ka ng compression or obstruction doon sa superior vena cava, syempre mai-impede yung blood flow pabalik ng dugo, pabalik doon sa heart. So, magkakaroon ka ngayon ng increased pressure in the veins of face and arms. Yun yung magre-result kung bakit nagkakaroon ng face and arm edema. Yon. Tapos, sa taas po merong spread tumor to pleural surface. Yun yung nagiging reason kung bakit may chest discomfort and pleural effusion or yung water doon sa layers po ng pleura po. Then, airway invasion, sir, hindi ko masyado na kung ba't nagkakasya ng hemoptysis, hindi ko nabasa po. Then, sa kanan na po, magkakaroon ng yung tumor secretes biologically active substances, then magre-resulto ng paraneoplastic syndromes. Yung paraneoplastic syndromes is triggered by abnormal immune response to a cancerous tumor known as neoplasm. So, dahil doon magre-result to Lambert-Eaton syndrome. Yung Lambert, ay immune system, ang nangyayari po dito sa Lambert na to, immune system attacks the connection of nerve and muscles, kaya nagre-result po ito ng muscle weakness. Then, dahil nga po dito sa paraneoplastic syndromes, magkakaroon ka din po ng increase in transforming growth factor beta 1 na magre-result po sa increased extracellular matrix protein na dahilan kung bakit mayroong finger clubbing po. So, sir, may nabasa akong article na parang nag-test sila ng mga patient na iba-iba yung level nitong transforming growth factor beta 1. Nakita nga nila na kasi yung mga patient na merong mas matataas na level nitong transforming growth beta factor 1, yun yung kadalasan nag-show ng symptoms po, nagkaroon po nitong finger clubbing. So, ina-associate po nila yung increase nito sa pagkakaroon po ng finger clubbing po. Then, meron din pong increase in parathyroid hormone-related protein na siya yung responsible sa pagre-release nitong calcium. So, dahil nga nagkaroon ka ng increase nito, magkakaroon din ng increased calcium release from bones that will result to hypercalcemia. Then, sir, magkakaroon ka din ng increase ng antidiuretic hormone. Kaya magkakaroon ka ng syndrome of inappropriate antidiuretic hormones secretion doon. Dahil nga antidiuretic to, magkakaroon ka ng increased water reabsorption that will result to hyponatremia or yung low sodium concentration sa blood po. Then, magkakaroon ka ng increased adrenocorticotropic hormone na magre-result sa increased cortisol release and production. Dahil nga meron kang increased cortisol release and production dahil sa prolonged exposure mo doon sa cortisol, pwedeng mag-cause yun ng Cushing syndromes na magre-result sa muscle weakness, hyperglycemia, and severe hypokalemia. Ayun po, sir. Okay na ako, Pat? Sir, kayo na po ba sa part na to?
Okay. So, basically, you have discussed yung lung cancer, tama? Okay. So, yung question nyo kanina, ano yung nakaligtaan mo? Bakit hindi mo daw, yung binanggit mo hindi mo na-pass or hindi mo napag-aralan. What was it?
Yung sa hemoptysis, sir, yung sa...
Kung bakit meron hemoptysis of lung cancer. Okay. Basically, you have, pahalagi sa pathophysiology, you have hemoptysis during the lung cancer. It is because basically your bad cells are attacking your good cells, right? And your good cells are absorbing nutrients through your hemoglobin. Now, since there's an absorption of nutrients of your good cells, okay, ano nangyayari dyan? Yung bad cells, inaagawan niya yung nutrients for the good cells. And the good cells, because of because of the absence of the nutrients, nagne-necrose siya. And when that particular cell necrose, okay, when that particular cell necrose, the nearby cells are being affected. It became inflamed, and later on, nagbe-burst siya, which causes the hemoptysis. So basically, the cells that we are pertaining to are the cellular cells in the pulmonary level. So what are the cells? Nabanggit ko na to previously in the COVID-19. Basically, inside your cells, you have three types of cells. You have your pneumocytes 1 and pneumocytes 2. And what was the other one? The last one? Binanggit ko sa inyo, tatlo yun. Anyone? Yes. You have your phagocytosis. Okay? So, what cells is being greatly affected during the lung cancer is of course your pneumocyte 1 and pneumocyte 2. Your phagocytosis still functions pero hindi na siya ganun kalawak ang kanyang functionality for the purpose or for the reason that mas marami na kasi ang bad cells na nakapalibot. Okay? So yung phagocytes 1 and phagocytes 2, pneumocytes 1 and pneumocytes 2, anong function ng pneumocyte 1? That's basically for your gas exchange. And pneumocyte 2 for gas exchange and lung recoil for the tension. Okay, so when those both cells are being affected because of the lung cancer, then that would lead for your atelectasis also. So kapag karoon ka ng atelectasis, there are gradients of blood also doon sa kanyang atelectasis that may be evident through hemoptysis. Okay, so that's the reason you have hemoptysis during the lung cancer. It is because of the massive invasion of the bad cells. It is because of the necrosis of the good cells, and it is because of the inflammation of the remaining good cells, and it is because of the atelectasis of your lung alveolar, specifically your pneumocyte 1 and pneumocytes 2. Okay, proceed with the question. Proceed with the questions. Hey.
Ay, ako din ang magbabasa nito, sir.
Ikaw na din. At yung sagot, ikaw na din.
Ala, ba't pati sagot, sir? Sige, sir. Hindi, tatanungin ko na lang din sila, sir.
Ganyan kita ka-love eh.
Wala. Parang tanga. Sir, ito na yung una. Hindi, tanongin ko na lang din sila, sir. Nalimutan ko na ito. Yung una, sir. The client with which of the following types of lung cancer has the best prognosis? Yun. A, adenocarcinoma. B, squamous cell. C, small cell. Or D, non-small cell. Yan. Classmates, tingin nyo ano yung sagot dito. D. So D daw, non-small cell. Nabanggit ata to kanina dun sa, wait, hanapin na. Nabanggit ata to dun sa taas. Best prognosis. Tama ba, Sir D? Nalimutan ko kasi. D. Yung makitin. Eunice, tama ba? D. Ayan. D daw yan. Yung may best prognosis ay non-small cell. Sorry, sir, hindi ko kasi nabasa ito. Pa-next part.
Okay, it's not... Oy, balik muna.
Balik mo daw, Pat.
Balik sa question number 1.
Ayun na pa, sir.
Why do you think why do you think non-small cell lung cancer has the best prognosis? Tickle your mind. What do you think the answer? Why? Anyone? None? In 5, 4, 3, 2, 1. None? Okay. So we all know for a fact that when you have a cancer, okay, the end stage of that, kapag hindi na alagaan o hindi na controlled, would be a metastasis. Tama? Now, why you have a better prognosis with non-small cell is that because when you have a non-small cell, when it metastasizes, okay, bilang non-small cell niya, ibig sabihin, hindi siya maliit. So, therefore, it's a quite big thing. Now, if it's a non-small cell, and it's quite a big thing of a cell na nagka-cancer, when it metastasizes, okay, what happens for that particular cell, that cancer cell, will not be able to metastasize or travel to other parts of your body for one reason. It is big enough to pass through your cells. Remember, to pass through your lung. Remember, your lung from the alveolar level, dun kasi nagsisimula usually ang cancer, it would pass through sa mga maliliit na tunnels, di ba? Now, since it is a non-small, hindi siya makaka-travel doon, it will not be able to cause metastasis much. It may only cause metastasis if the non-small cell is enough na maliit na makapass through doon. And that's the reason, that's the reason, ito yung may pinaka-best prognosis. Because you can isolate the cancer cell within the alveolar level. And kung ma-isolate mo siya, you can easily detect kung nasaan siya, and you can easily detect where to poke your intervention. And that's the reason why it is of the best prognosis. Okay? And of course, both naman adenocarcinoma and squamous cell, they are, compared the two, squamous yung medyo okay. Kasi remember, squamous, these are epithelial cells that is responsible for your fluid, for your lubrication in your lungs. However, we have medication that can alter or can mimic that particular the function of the squamous cell. Small cell is somehow the dangerous one because it can travel from your lungs to your heart, to your brain, and to the certain parts of your body because of its small size. Okay? And because of also of this small size na yan, pwede din siyang bumara enough doon sa inyong passage, which may result to pulmonary embolism as well. Okay? Next question.
Next question, which of the following is the primary goal for surgical resection of lung cancer? A, to remove the tumor and all surrounding tissue. B, to remove the tumor and as little surrounding tissue as possible. C, to remove all the tumor and any collapsed alveoli in the same region. Or D, to remove as much as the tumor as possible without removing any alveoli. Sir, feeling ko C yung sagot dito. Kasi yung daw, yung lung ang ginagawa daw dito is nire-remove yung lobe ng lungs. So, feeling ko, sir, C yung sagot dito. Tama po ba, sir? Feeling ko lang naman yan, sir.
Okay, so the question is, which of the following is the primary, okay, primary goal? Pag sinabi natin primary, optimal goal for surgical resection of lung cancer, okay, to remove the tumor and all surrounding tissue, that's A. To remove the tumor and as little surrounding tissue as possible, that's B. To remove all of the tumor and any collapsed alveoli in the same region, that's C. And D. To remove as much as the tumor as possible without removing any alveoli. So when you are confronted of this kind of question, tingnan nyo, doon sa mga choices, lahat remove, di ba? Think of a question na mukhang magkamuka naman ang sagot. Okay? So, kung titingnan nyo dito, tumor, any collapsed alveoli in the same region, to remove as much as tumor as possible without removing any alveoli. Kung makikita nyo to, okay, ang halos magkatulad na sagot pero magkaiba lang ng content, remove and all surroundings. Ito, and as little surroundings as tissue. Kung mamimili kayo sa A and B, anong possible answer? Nagigets nyo ba? Kapag pipili kayo ng tanong, okay, kung makikita nyo, okay, nakalagay dito, to remove the tumor, ang kamukha niya, to remove the tumor, letter B. Okay? Kapag nakikita kayo ng mga ganitong choices, hahanap kayo ng choices na magkamukha, pero magkaiba lang ng modifying factors. For example, kapag pinapili ka for a certain, what is the sign and symptom of dialysis disequilibrium syndrome? A, hypertension. C, increased cardiac out. Hypertension. B, decreased cardiac output. C, hypotension. D, edema. Kapag nakita mo ni apat na choices na yon, merong magkamukha. Magkaiba lang ng function. Hypertension A, C is hypotension. Eliminate mo na agad yung iba. Ang pagpipilian mo na lang yung magkasalungat. Hypertension and hypotension. Now, pag in-eliminate mo na doon, meron ka na lang 50 chance of getting the correct answer. So, hypertension ba o hypotension? Okay? Kasi opposite sila, di ba? They are both speaking of the blood pressure, but they are pertaining to two different reactions. The one is elevating, the one is dropping. Okay? Kaya nga binigay sa inyo yung ganun yung choice na yon para malito kayo. Ano nga ba talaga? Okay? So, doon, sa sagot na tinanong ko, hypotension ang correct answer doon. So, dito kung makikita nyo, remove all of the tumor, remove as much as the tumor. So, parehas naman ang ibig sabihin nito. Okay? Any collapse alveoli in the same region? As possible. So, kung yung as possible, hindi pwedeng as possible. Kasi dapat, all. So, eliminated na yung D. Remove all of the tumor and any collapse alveoli in the same region? No. What if nearby regions or other regions has alveoli, collapse alveoli? Hindi mo ba siya aalisin? No. Kasi pag hindi mo siya inalis, okay, that would result to another progression of cancer. Pero kung titingnan nyo dito, yung C pala at D, eliminate na natin to remove the tumor and all surroundings. Ito namang isa, to remove the tumor and as little surroundings tissue as possible. So binabanggit nito, parehas to remove the tumor. To remove the tumor, pero surrounding na yung modifying natin. Surrounding all tissue, all surrounding tissue, dito naman as little surrounding tissue as possible. Now, kung itong dalawa na lang i-isolate nyo to make a choice kung sino ang tamang sagot or alin tamang sagot, you have a greater chance of getting the correct answer na. You have a 50% of getting the correct answer na. So, with this, kapag all surrounding tissue i-remove mo, this would be accounted to, even the good one would be removed. So that would give you, no, it's not the correct answer. Therefore, the correct answer is B. To remove the tumor and as little surrounding tissue as possible. Okay? Why? Kung makikita mo as little surrounding tissue as possible, hindi niya binabanggit whether bad or good tissue ang i-remove mo. But of course, we all know for a fact, a bad tissue would be removed. Pero di ba binanggit ko sa inyo kanina, okay, yung mga good tissue, okay, when there are tissues that are necrosing, it can affect the good tissue. So yung mga nearby surroundings then, okay, nearby surroundings din nung bad tissue na ni-remove, you would remove that as well, but not definitely all the surrounding. So the correct answer is B. Parehas lang to remove the tissue, they both speak of the surrounding, but the difference is that the other one speaks to remove all and the other one speaks only the little. Did you get how to answer the particular question? Oy.
Opo, sir.
Okay. Next question.
Yes. Ay, shit. In the client with terminal lung cancer, The focus of nursing care is on which of the following nursing interventions? A. Provide emotional support. B. Provide nutritional support. C. Provide pain control. Or D. Prepare the client's will. Ayun po. So, A ata to, sir. Hello, sir. Tama po ba, sir?
What's your answer?
Ano po? A po. Hula ko lang, sir.
Okay. So the question is, in the client with terminal lung cancer, what do you mean by terminal?
Last stage na po ata, sir.
Terminal, last stage, okay? So, last stage na, kaya nga terminal. The focus of nursing care is on which of the following nursing interventions. Okay, kapag terminal na, we already understand that the patient is near his or her death. Tama? Okay? We don't want to sound it that way, but that's the fact, that's reality. That the patient is nearing his or her death. Okay? Now, yung question natin is, balikan natin ulit ang ating service sa nursing. We are to provide what? Peaceful death. Sino nag-define nun? Sinong theory nag-define niya ulit nun? Virginia Henderson. Kalimutan nyo na. Okay? Susumbong ko kayo sa nagturo ng TFN sa inyo. Okay, so if that is the case, okay, provide emotional support. If it's terminal, come to check your mind, okay? Hindi it didn't happen 24 hours. It happened and the long battle na. Okay? So chances are as you go along with the battle, you have already underwent emotional support. Okay? So that's not the primary or that's not the focus. Okay? Nutritional support. Knowing for a fact that the patient is already in terminal stage, nutritional support is still important, but not a primary focus. Because nutritional will never make the patient regain her previous status na wala siyang cancer. So it is important, but not the focus. Since it's terminal, ang ihahanda natin sa pasyente ay death. Okay? Now, prepare the client's will. Is that correct? At some point, it would be correct. Yes. Because you are asking for the patient what his or her plans are pag namatay siya. Anong ibibigay niya? Anong iiwan niya? Anong gusto niya? I-revive pa ba siya kapag naghihingal na siya? Or hindi na? So that would be a good one. But when we go back to our service, our definition is to provide peaceful death. And for you to be able to provide peaceful death, since it's terminal, you need to provide as much comfort to your patient. And to provide comfort to a patient with lung cancer, you need to control his or her pain. So the correct answer is letter C. Did you get how it goes?
Yes, sir.
Okay, next question. Any? Oh, Anemia A. Sino sa Anemia A?
Anemia ata yan, sir.
Anemia pala ito. Okay, anemia. Sino na?
Ako po, sir. Sir, rinig po ba?
Laban na.
Okay. Patrick, next. Definition. Decrease in the number of red blood cells which lead to decreased hematocrit and hemoglobin content. A condition in which you lack enough healthy RBC to carry adequate oxygen to Patrick next. Yan, sa red blood cells, etiology, bone marrow and kidney. Sa origin, blood loss, deficient erythropoiesis, hemolysis, and yung RBC destruction. Next part. These factors, predisposing, intestinal disorder, chronic condition, family history, age, precipitating, menstruation, diet lacking certain vitamins and minerals, pregnancy, exercise, lack of sleep. Next, what? Signs and symptoms. General fatigue, weakness, dyspnea, jaundice, chest pain, pallor. Next. And sa diagnostics, CBC, blood studies, iron studies. Sa medical management, medication, nutritional supplements, corticosteroids, sa treatment, blood transfusion, saka intravenous fluids. What next? Sa assessment, signs and symptoms, health history and physical exam, medication history, nutritional assessment, saka family history. Sa diagnosis naman, fatigue related to decreased hemoglobin and diminished oxygen carrying capacity. As jaundice related to yellowing skin caused by the liver malfunctioning. As altered tissue perfusion related to insufficient hemoglobin nutrient. What next? Nursing management. Sa planning, decreased fatigue, thus attainment to adequate nutrition, maintenance of adequate tissue perfusion, compliance with the prescribed therapy, absence of complication. Sa intervention, to manage fatigue. Yeah. Prioritize activities, assist patient in prioritizing activities and establishing balance between activities and rest. To maintain adequate nutrition, diet, encourage a healthy diet that is packed with essential nutrients. Inform patient that drinking alcohol interferes with the utilization of essential nutrients and advise the patient to avoid or limit his or her intake of alcohol beverage. Dietary teaching session should be individualized and involve the family members and include cultural aspects related to the food preference and Patrick next. Okay, natawag. Wait lang po sir. Natawag. Yan, to maintain adequate perfusion, blood transfusion monitoring, should monitor the patient vital signs and pulse oximeter reading closely, promote compliance with prescribed therapy, enhance compliance, assist the patient to develop ways to incorporate the therapeutic plan into everyday activities. Medication intake, assist patient receiving high dose Yan yung steroids. Tapos yung evaluation, report test fatigue, attains and maintain adequate nutrition, maintains adequate perfusion, absence of compliance. Complication pala. Auto tissue. Nasa auto tissue. Yung una,
Well, Manila, usually Tagalog lang naman.
hematopoiesis ay yung production of all cellular components of blood. Yan, yung which includes organs and tissues such as bone marrow, liver, and spleen. Yan. So, next. stem cells, hemocytoblast, hemocytoblast, general stem cells, uh, which according to the monophyletic theory blood cells, cell formation, all blood cell form, including both erythrocytes and leukocytes. Sa myeloid stem cells, yan, differentiate into erythrocytes from progenitor cells which forms erythrocytes, tas sa thrombocytes which forms platelets, tas sa proerythroblast. What are the... Ikaw, tumawag. Yan. Tapos yun, naaapektuhan yung yung red blood cell production which leads to decreased oxygen levels. Tapos kapag sa kidney tumama, increased EPO, ibig sabihin ng EPO is erythropoietin. Tapos kapag mataas yung level ng erythropoietin mo, ibig sabihin may anemia. Tapos kapag may increased erythropoietin na, sa negative feedback mechanism, magre-release ng RBC yung red bone marrow which increase oxygen levels. Tapos kapag sa organ system, yan sa CNS, Central Nervous System, magkakaroon siya ng fatigue. Tapos sa respiratory, dyspnea. Tapos sa muscular, weakness. Tapos sa heart, chest pain. Tapos sa liver, jaundice. Alam po sir. Tapos yung sa question. Question na. A client with firm. Sir, kayo na ba magbabasa na? Lang?
Ikaw.
Kaya na. Ako. A client with pernicious anemia asks why she must take vitamin B12 injection for the rest of her life. What is the nurse's best response? Question itong tawag. A. The reason for your vitamin deficiency is an inability to absorb the vitamin because the stomach is not producing sufficient acid. B. The reason for your vitamin deficiency is an ability to absorb the vitamin because the stomach is not producing sufficient intrinsic factor. C. The reason for your vitamin deficiency is an excessive excretion of the vitamin because of your kidney dysfunction. D. The reason for your vitamin deficiency is an increased requirement for the vitamin because of rapid red blood cell production. So, kapag sinabing B12 injection, ay yung para sa anemia. Pero yung pernicious anemia, hindi ko alam yun eh. Pernicious anemia. Ayun, vitamins pala yun, yung B12 injection. Tapos yung best response yan is duo. Christian, yung sagot mo.
What's the answer?
Ay, yung sagot po ni Christian D, nahiya akong magsabi.
Ang sagot?
Di daw po, sabi ni Christian. Tumawag po sa akin.
D?
D.
Okay, so ulitin natin. The question is, a client with pernicious anemia asks why she must take vitamin B12 injection for the rest of her life. What is the nurse best response? The choices are A. The reason for a vitamin deficiency is an inability to absorb the vitamin because the stomach is not producing sufficient acid. B. The reason for your vitamin deficiency is an inability to absorb the vitamin because the stomach is not producing sufficient intrinsic factor. C. The reason for your vitamin deficiency is an excessive excretion of the vitamin because of kidney dysfunction. D. The reason for your vitamin deficiency is an increased requirement for the vitamin because of rapid red blood cell production. Okay. So sinabi ko sa inyo, when you try to eliminate choices because you would like to isolate two choices na lang na pagpipilian, you look for choices that has or for that speaks the same wavelength but of different modified factors. So among the four, you can choose two. For example, the reason for your vitamin deficiency, lahat sila deficiency binabanggit. Why they are speaking for deficiency? Because basically, kaya kang magbibigay ng B12 injections because you have deficiency. Now, okay, you need to isolate two. Yung vitamin deficiency sa letter D is increased requirement of vitamin daw. Ano ba ito nawawala? Okay? Yung sa letter C, reason for vitamin is an excessive excretion. Sa B, vitamin deficiency is inability to absorb. Sa letter A is inability to absorb. So therefore, may nakita na ako, sir. Yung sa apat na deficiency, dalawa doon nagsasalita tungkol sa inability to absorb. So the answer is between A and B lang ang choices. Because they both speak inability to absorb. Yung C at D, pareha silang walang sinasabi na magkatulad. So eliminate si C, eliminate si D. A at B na lang. They both speak of inability to absorb, which is the same wavelength. But now let's see the modifiable factors. Inability to absorb sa A because the vitamin because the stomach is not producing sufficient acid. B, an ability to absorb the vitamin because the stomach is not producing sufficient intrinsic factor. Now, parehas inability to absorb sa stomach part, and the reason is what? Is it because of the sufficient acid production or insufficient production of intrinsic factor? We all know for a fact na kapag pinag-usapan natin sufficient acid, it will not correlate to B. Okay? Why? Because sufficient acid will not be able to absorb B12 because acid will make it break down. Kaya nga siya acid, di ba? Acid breaks down. It never combines or it never absorbs. Therefore, between A and B, the correct answer is B. Okay? Isa sa Isa sa way of answering a board exam like question is you identify choices that speak of the same wavelength at doon nyo na lang pagtatalunan kung ano yung modifiable factors. So among the four, they all speak of the same wavelength that there is deficiency. Okay? But among the four, there are only two that speaks of the same wavelength inability to absorb. And of the inability to absorb, doon nyo na lang aalamin whether it is acid or intrinsic factor. But we all know for a fact that acid will never let you absorb or combine, instead break down or metabolize. Then the correct answer is intrinsic factor. Did you get how to answer this one? Doon sa mga concept na pag nabasa nyo, parang hindi naman namin napag-aralan to. Remember, the board exam question is not how much you know, but how wiser you are in answering. Okay? So for you to be able to find a way to answer a question that first time yung narinig, you make or you find the trick on how to do it. So yun lang yung nasabi, you identify two choices or two options na magkamuka, pero yung modifying factors na doon lang sila magkaiba, pero magkamukha sila. Okay? Next question.
But next, a client comes into the health clinic 2 years after undergoing a section of the terminal ileum complaining of weakness, shortness of breath, and a sore tongue, which client statement indicates a need for intervention and client BP. A. I have been drinking plenty of fluids. B. I have been gargling with warm salt water for my sore tongue. C. I have 3 to 4 loose stools per day. D. I take a vitamin B12 tablet every day. So, ayun, ulitin ko. A client comes into the health clinic 3 years after undergoing a resection of terminal ileum, complaining weakness, shortness of breath, and a sore tongue, which the client statement indicates a need for intervention in a client BP. Wait lang. Yung ano po, D. Ay yung A. Sure.
What's the correct answer?
Ay yung ano po, yung I quit the statement.
What's the answer?
Yung SIP po, C.
Okay.
C po.
Sa ganitong klaseng question, okay, sa ganitong klaseng question, ano ba yan? Ano muna, i-mute, medyo malakas. Okay. Sa ganitong klaseng question, okay, I repeat the question. A client comes into the health clinic 3 years after undergoing a resection of the terminal ileum, complaining of weakness, shortness of breath, and a sore tongue. Which client in statement indicates a need for intervention and client teaching? Okay? Kapag ganito ang klase ng tanong, if you would be trying to read this one, okay, sure, wala dito yung sinasabi mo kaninang magka-wavelength, but of different modifiable factors. So, hindi yun ang choice ng technique na kailangan mong gamitin. Okay? Every time, balik ka, pag ganito, merong mga parts of the body na pinag-usapan, anong subject ang dapat mong balikan? You have two subjects na dapat balikan. Anong subjects yun?
Health assessment.
Anatomy.
It can be, pero ang dapat mong balikan is your anatomy and physiology. And ano pa? You need to return sa biochemistry mo or sa yung pharmacology. Now, let's try to eliminate the good answers. Okay? Dito kasi mga good answers ang meron. So first is A, I have been drinking plenty of fluids. Kapag fluids ang problema or fluids ang issue, ang dapat natitingnan natin problema, kidney. Tama? Anatomy. Tama ba ako? Uy.
Opo.
Tama ako, okay? Now, is the problem speaks of the kidney or it speaks of your gut? It speaks of your gut. So therefore, A is not the answer. Ibig sabihin, uminom ka man ng konti o maraming fluids, it will not affect your gut because it affects your kidney. So that is not the answer. Eliminate it. Letter B. I have been gargling with warm salt water for my sore tongue. Does it affect your gut? Sir, chances are yes. Why? Because remember, the alimentary tract or your digestive system includes your mouth. But how far is your tongue from your ileum? Would that affect? I believe, sir, it will not affect. Sabi naman kasi, ang sabi, gargling. Hindi naman sinabing ininom. Okay. So what you do, you are now to eliminate letter B. And then, the remaining is letter C and letter D. I have 3 to 4 loose stools per day. Mukhang problematic to, sir. Kasi nga, ang affectation neto ay digestive system. So let's retain. Let's read letter D. I take a vitamin B12 tablet every day. Sir, mukhang hindi. Mukhang mali. So the correct answer is, balik ang anatomy physiology. The correct answer is,
C.
the correct answer is,
C.
the correct answer is letter D. It's dog. Why it's letter D? Sir, nilito mo kami. Okay. The problem is this. A client comes into the health clinic 3 years after undergoing a resection of the terminal ileum. Okay? We all know for a fact, kung natatandaan yung anatomy physiology nyo, na ang absorption ng B12 ay nangyayari sa ileum, sa terminal ileum. The intrinsic factor is being released by the stomach. It would travel with your vitamin B12 and will be absorbed in your terminal ileum. Now, if the patient is still taking vitamin B12 every day, would that be absorbed or would that just simply build up in your body? It will only build up in your body. And that's the reason why you have weakness, shortness of breath, and sore tongue. Dahil hindi naman nadidistribute ang B12. And that's the reason the correct answer is D. Kasi mali ang ginagawa ng pasyente na uminom ng vitamin B12 knowing for a fact na wala na siyang ileum to absorb the vitamin B12. Yung I have 3 to 4 loose stools every day, it's a concern. Okay? It is a concern. Okay? But what is being asked indicates a need for intervention in client teaching. Client teaching. So, kailangan turuan ang pasyente. At unang kailangan mong turuan, if for 3 years na siya nagiinom ng B12, ay ma'am, mali po na nainom pa kayo ng B12 kasi po nagkaroon na kayo ng reception ng terminal ileum. Ang terminal ileum po responsible to absorb vitamin B12. But since it is being resected already po, hindi na po na-absorb ang B12. So ang B12, nagbi-build up lang po sa katawan. Have you provided the client teaching? On that aspect, yes. That's therefore, the answer is vitamin B12. Oh, alamin, anatomy physiology, diniscuss yan panigurado. Okay? So that's how you're going to answer your board exam question. Next questions.
But, next. Yan. Question 3. A client was admitted with iron deficiency and anemia and blood streak emesis. Which question is most appropriate for the nurse to ask in determining the extent of the client's activity intolerance? A. What activities were you able to do 6 months ago compared with the present? B. How long have you had this problem? C. Have you been able to keep up with all your usual activities? D. Are you more tired now than you used to be? Yan. Sagot ko po, Sir, C.
1,
Have you been able to keep up with
Why?
all your visual activities? Sir? Ano po,
Anong
sir?
sagot mo?
Si po.
C. Okay. C. Anyone? Okay, C. Okay. So, eliminate ulit natin. If, for example, if I need to eliminate this one, ulit, uy, sino ba yung maingay? Ako na yung maingay. Okay? A client was admitted with iron deficiency and blood strict emesis. When we talk about deficiency anemia, iron, ibig sabihin, you have enough blood, but you have deficient in iron in your blood. Remember, your iron is responsible for holding your hemoglobin through your heme. And blood streak emesis, pag sinabi natin blood streak emesis, nagsusuka ng may
Dugo.
blood streak, okay? Which question is most appropriate for the nurse to ask in determining extent of the client's activity intolerance? So, hindi na natin focus ang strict emesis. Hindi na rin natin focus ang iron deficiency anemia. Although, we all know for a fact na na-reason natin bakit siya may activity intolerance is because of the iron. Because when you have a poor iron number in your body is mahuna, or should I say malambot. So the question now is, paano natin malalaman yung activity intolerance ng pasyente? Now, the choices are A, what activities were you able to do 6 months ago compared with the present? B, how long have you had this problem? C, have you been able to keep up with all your usual activities? D, are you more tired than now than you used to be? So, kapag ganito, you are to measure activity intolerance. When you are to measure something good over something bad, or the other way around, something good. So, like for example, here you have a negative activity intolerance. So therefore, you are to compare activity intolerance with activity tolerance. Tama ko? So when there is comparison, the answer should be of comparison as well. So the choices are this. Kapag pinili mo yung B, how long have you had this problem? You'd only learn to know gaano na to katagal nangyayari. But you will not know, you will never know if before nagagawa niya ba to or hindi. Okay? Letter C, have you been able to keep up with all your usual activities? You'll only learn kung ano yung mga hindi niya na kayang gawin ngayon. Okay? But you will never know kung paano niya nagagawa noon. So meaning you will create another question to answer that particular question to further your investigation. So we only have A and D. Are you more tired than now? Are you more tired now than you used to be? Bakit good option to? Sabi ko kasi, there should be a comparison sa baseline or from previous to present or present to future. Meron ba comparison sa letter D? May comparison tayo sa letter D?
Somehow, sir, meron po.
Meron. Kasi nga, than. When you use than, then you are comparing it. Diba? So, retain natin. Letter A. What activities were you able to do 6 months ago compared with the present? Merong comparison or wala?
Meron po.
Meron comparison. However, among the two, okay, are you more tired now than you used to be? It's a close-ended question. It's a yes or no. If the patient answers yes or no, you need to further another question para maka-elicit ng further answer. So letter A, it's more inclusive. It's more inclusive. What do I mean? It's more thorough. Kasi marami ka nang makukuha sagot. What activities were you able to do 6 months ago compared with the present? You'll get to know, nagbigay ka ng oras, okay? So time-bounded siya, 6 months ago, what are those activities? Kung noon nakapag-dumbbell ka ng ilang oras, how about ngayon? So it would elicit more answers because it's not a closed-ended question. So the correct answer among A and D is, between A and D is letter A. Okay? Letter A. Question, meron pa ba yan?
Wala na po. Tatlo lang po.
Okay, next reporter.
Sir, may tanong daw po si Alex. Tanong po, sir.
Okay, so there's a question here from Alex. Okay. Sir, di ba po ang isa sa treatment for anemia is blood transfusion? Bakit po need ng plain NSS during this treatment? For dilution po ba? Or may iba pa pong reason? Okay. The answer is never for dilution reason. Never for dilution reason. The answer of why we are requiring for plain NSS, or should I say muna, why plain NSS? Plain NSS ang ginagamit natin for patient generally for blood problems. It is because plain NSS is what? Isotonic. When we talk about isotonic, the solution will not result for the nearby cells to tawag dito, to shrink or to swell. Okay? Pag hypertonic, ang solution mo, ibig sabihin, mataas ang solution mo, these are yung mga 5% solution, 45% solutions, okay? Ano nangyayari? Pag pumasok sa ugat, si hypertonic solution, mataas masyado, di ba, ang kanyang concentration. So, ang dadaanan niyang nearby cells, okay, mababa ang solution. Kapag mababa ang solution na yon, ang mangyayari, tatakbo yung remaining fluids ng cell papunta doon sa vascular. So, yung cell nagsishrink. Okay? Pag hypotonic solution naman, mababa ang solution ng ipapasok natin sa inyong ugat, and then yung nearby cells na dadaanan niya, mataas ang solution. So, what would happen? Yung hypotonic solution would result para pumasok sa cell, so mag-shrink ang cell, mag-expound ang cell, mag-swell. Sa isotonic solution, usually the plain NSS yan, the 0.9 NSS or the plain lactated ringers, pag pumasok yan, balance lang ang pressure ng nasa ugat at ng nasa cell. So walang magbabagong change, walang changes. Okay? So kaya yun ang ginagamit natin. Now, why do we put plain NSS? The reason is that, okay, first is we need to flash out your ugat. We need to flash out because baka merong mga remaining debris ng patay na red blood cells na nandun. So we don't like that to stay there. Okay, if there's any. But we all know for a fact naman nakakainin din yung phagocyte. So mawawala din. But at least we flash it out from the area kung saan papasok si dugo. That's the first reason. The second reason is that when you have anemia or you have a massive blood loss that would result for you to require blood transfusion, okay, ibig sabihin, meron kang kakulangan ng blood volume sa iyong ugat. At pag meron kang kulang na blood volume sa iyong ugat, that would result for your heart not to pump well. Kasi wala siyang ipopump eh. You have kulang na blood cells eh. You are kulang with red blood cells, pack RBC, tama? Ng blood. So, while the blood is being prepared bago isalin, for the heart to function while waiting for the blood to be infused, ang ipapump out ng blood ay yung saline. Kaya yun ang pinapasok natin sa ugat ng pasyente. To flash, and of course, to prepare, to flash to prepare, and then second is of course, to provide that the heart will be able to function well at hindi magko-coagulate yung ugat ninyo. Kasi remember, kung yung ugat ninyo tuyo, can you imagine yung umiinom kayo ng soft drink sa plastic? Dahil walang dugo, for example, yung soft drinks yung dugo, sinipsip nyo ng sinipsip yun, di ba, nag-shrink siya? You all know that the blood vessel is highly vascular. So, kapag highly vascular yun, pag nagdikit yun, magdidikit talaga yun. So, for that to remain expanded, bukas siya, bilog siya, kailangan may magdaan doon. At ang ipapadaan natin doon, plain UNSS or normal saline while waiting for the blood transfusion. Alex, nasagot ko ba tanong mo? Alex. Okay. Any questions? Nan? O, continue.
So, ayan, hypertension. Nadidinig po ako, sir. Okay na po.
Yes.
So, ayan. For the third topic po, yung definition po na in-include ni Bonbon is isa-summarize ko na lang po. Then, same pa rin naman po sila, papasimplihin lang po natin. Then, i-elaborate ko din po yung ibang good to know para mas maintindihan pa po natin si hypertension. So, next po. Next. So, hypertension or HTN for short is defined as a systolic pressure greater than 140 mmHg and a diastolic pressure of more than 90 mmHg. So, ano nga ba si blood pressure? Why is it necessary? So, si blood pressure po, ito po yung amount of force or bilang certain blood against arteries. Also, i-measure po niya kung gaano kalakas or efficient si heart mag-pump to deliver blood throughout sa katawan po natin. Then, alam naman na natin kung ano si systolic and diastolic. Familiar na tayo. Dahil, of course, vital kapag nag-BBS tayo sa duty. And, napag-aralan na natin siya before. So, systolic, ito yung unang inire-record or yung top number, which is the maximum pressure. Then, after is yung bottom number naman, which is the diastolic. Systolic, ito yung absolute pressure, yung contraction of heart muscle. Diastolic po kapag ang pressure sa arteries is between beats. And then, additional lang po, si mmHg or millimeters of mercury, kaya po siya ang ginagamit to measure the blood pressure, is that because before po, yung mercury po, yung mercury daw po yung kaunahang ginamit na accurate. Hindi ko masabing tool po. Basta accurate to measure a pressure gauge po. Yun. So, kung mapapansin niyo po kapag nag-BP tayo kay patient or sa sarili natin, 'di ba? Tutok na tutok tayo kay systolic. Kasi baka mamaya baka mamaya mataas na pala si systolic. Then sa diastolic naman, like kung halimbawa tayo yung bini-BP, ramdam na ramdam natin yung pag-beat, then kita natin sa BP app or doon po sa manometer gauge yung paggalaw niya pag nag-release na. So, ayan, sabi ko nga kanina, bakit po necessary si blood pressure? Kunin si blood pressure. Because po, for early prevention na rin siya, tapos mas maagapan din po. Kung halimbawa po na may unhealthy lifestyle ka, early detection na rin po siya. Then, sabi po din sa nabasa ko is, to avoid complications na din daw po. So, ayan, sabi po dyan, next po. Ayan na ba? Okay, sige, yung next pa niyan, kasi next ko pong i-discuss yan. So, ayan, sabi dyan, masasabi po natin may hypertension po ang isang tao kapag nag-seek na po siya kay healthcare provider na ang average ng blood pressure po niya is the same during 2 or more consultations po. And then, si hypertension din po is also termed as a silent killer. So, ayan. Nakalagay ba dyan? Sa next pa yata ang slide yon. Uy, pat, nasa taas ka. Yung next slide po. Yung next. Pataas ka. Ayan, yan. Yan. Si hypertension daw po is also termed as silent killer. So, bakit nga ba? Again, according po dun sa nabasa ko, is mostly po, 24% of people who had blood pressure po exceeding 140/90 mmHg were unaware that their blood pressures were elevated. And then, additional lang po, wala rin silang other manifestations na nararamdaman and nalalaman lang nila once they seek help from the healthcare provider po or kapag na-check yung BP nila and they undergo some tests. Tapos po, in some cases, severe na pala, not knowing na gano'n na po pala ang status nila or may complications na po pala. Kaya, ayan, tinawag siya na silent killer. So, pataas po ulit. Yan. So, ito po yung classification ng hypertension. Meron po tayong 4 na categories. So, ayan, normal, pre-hypertension, stage 1 hypertension, and stage 2 hypertension. The normal range po for blood pressure is between less than 120 mmHg and less than 80 mmHg. Then, elevated po, ayan, si pre-hypertension or elevated stage po starts from 120 mmHg to 129 mmHg for systolic blood pressure and less than 80 mmHg for diastolic pressure. So, bali po, si Sir, ikaw na lang po, Sir, ang bahalang mag-confirm kung ano po yung standard talaga. But based po kasi sa mga ni-research ko is, ayun po yung lumabas. But, since magkaiba kami na resources, is yan yung kanya. Pero po, more or less naman po magkalapit naman sila. Depende na rin po siguro talaga sa standard. Then, for the stage 1 po, hypertension, nagsisimula po siya when the patient has a systolic pressure po of 130 to 139 and then the systolic pressure po of 80 to 89. Si stage 2 naman po, this starts when the systolic pressure po is already more than or equal 140 and the diastolic is more than or equal 90 po. And then additional ko lang din po, meron din pong tinatawag na hypertensive crisis. So, pwede rin siyang tawaging hypertensive urgency or hypertensive emergency. Si hypertensive crisis, ito yung BP, higher than 180 for systolic and diastolic for higher than 120. So, si hypertensive crisis po is an emergent problem or case na kasi po severe na siya. And this can cause po a high chance for organ damage or worse po, maaaring mag-lead ng bleeding into the brain or yung stroke po, heart failure, angina or non-stop chest pain, pulmonary edema, or yung tinatawag nating fluid sa lungs, then MI or heart attack, aneurysm, and eclampsia po for pregnant women. So, may additional lang din po ulit ako. So, kababasa ko kasi dyan, inalam ko po kasi yung parang difference nila. So, siguro aware naman kayo guys sa pulse pressure. Diba? So, napag-aralan na rin before yan. Si pulse pressure po, ito yung difference between systolic and si pulse pressure po, ito po yung difference between systolic and diastolic blood pressure. So, may basehan din po tayo dyan para malaman po natin kung ano nga ba yung normal blood pressure na nakuha natin kay patient. For example po, si systolic po is mina-minus or sinasubtract natin kay diastolic na nakuha natin. So, kung ano po yung result after we subtracted, ayun po yung pulse pressure. So, for example po, if your resting blood pressure is 120/80 po, your pulse pressure is 40, which is considered normal and healthy pulse pressure po. Then, nabasa ko pa, generally, yung pulse pressure po na mas mataas or greater than 40 is, abnormal na siya. Then, 40 to 60, yung normal po is 40 to 60. But, for those older adults po, nag-start na sila at the age of 50 po, nag-i-increase na daw po talaga yung pulse pressure nila dahil yung arteries po ng blood vessels nila is tumitigas na. But according din po doon sa ibang nabasa ko is high risk na daw po for older adults yung ganong pulse pressure. So, ayun po. Ano lang, good to know lang. Hindi ko kasi, depende rin siguro sa case. Yan. So, ayan. Pababa po, Patrick. So, 2 types na. Ayan, yan. Primary, yun type. Ayan. Sige, 2 types na. Then, ayan. Meron po tayong 2 types of hypertension. These are primary hypertension and secondary hypertension. So, isa-summarize ko na lang po ulit sila and sasabihin ko na lang yung difference. Si primary hypertension po, also known as essential hypertension, yung po sa kanya is wala pong sigurado or nagpapatunay sa possible cause or pinagmulan po niya. Pero ang assume or possible cause daw po na sinasabi is nalilink po siya sa altered pathways in blood pressure control po. So yung altered pathways po in blood pressure control leads to sustained constriction po ni arterioles resulting in increased peripheral resistance po in the blood vessels. As the heart continues to pump normally, yung pressure po in the whole arterial system is nagra-rise. Then, included din po kay primary hypertension yung genetic factors, diet po, especially kung increase po yung salt intake, obesity, insulin resistance, endothelial dysfunction, chronic excess alcohol, aging stress, saka sedentary lifestyle. Whereas si secondary hypertension naman po is yung high blood pressure that is caused by another medical condition. Sa secondary hypertension po, elevated po yung BP niya due to underlying cause. Like constipation po is mild renal disorders like chronic pyelonephritis, diabetic nephropathy, yan, vascular disorders, endocrine disorders, then drugs and other, yung gumagamit po ng other miscellaneous causes po, yun, obstructive sleep apnea, ganun. So, next po. Patrick, next. Okay na yan, secondary yan. Pat, okay na yan. Ayan. Sa etiology naman tayo. So, yung nakalagay kasi dyang origin niya is age, heredity, tsaka lifestyle. So, yung sa origin naman na nakita ko so mahaba po kasi yung pinagmulan ni hypertension. Bale, nag-start po siya in the year 1910, dumaan sa 1950s, 1960s, to 1990s, and then, ayan na, still now po, until 21st century, there are still studies about it. Yung sa origin po, hindi ko po sure kung may sense po ba yung mga sasabihin ko. Kasi ang haba po ng story niya. So, try ko na lang mag-come up dun sa pinaka-root niya. Kasi po, mostly po dun sa mga nabasa ko pong articles na sa origin ni hypertension is lang po, puro stories, tsaka yung naka-include lang po dun is yung invention ng mga gamot, tsaka po yung therapies. So, ayun po yung mostly na nabasa ko. So, ito na lang, yung para ma-highlight na lang natin sa hypertension. So, bali po, between 1910 and 1914, meron pong physicians na nag-define ng essential hypertension or yung primary hypertension po na sinasabi ko kanina, and tinawag naman nilang malignant hypertension yung sa secondary. According po doon, si essential hypertension po is defined po na elevated blood pressure when no other cause could be determined. So, mas simple siya doon sa sinabi ko kanina. And si malignant naman, daw siya, syndrome of severe hypertension daw po associated with target organ damage and high mortality from strokes, heart failure, or kidney failure. So, ayan, may point naman pala yung mga sinabi ko kanina, sir. So, pagtapos po niyan, dito na po, pumapasok si President Franklin D. Roosevelt. So, by that time daw po, si President Roosevelt was having hypertension. But hindi po siya nag-receive ng any treatment for another 4 years noong binigyan po siya ng phenobarbital treatment po and massage therapy for blood pressure na yung BP po kasi niya nun is 188/105. Then in February 1945 naman po, naitala na si President Roosevelt is nagkaroon ng 260/150 na blood pressure at the time of Yalta Conference. Kung saan naman po yung condition niyang yon by the time is yung health daw po niya is failing na with an evidence of heart failure, including shortness of breath, orthopnea, lethargy, and drowsiness. At the morning of April 12 naman po, 1945 pa rin, after ng conference, yung blood pressure po niya is umabot ng 300/190. Then, ayan, reported with a severe occipital headache while sitting on a portrait session. Then, after po noon, he subsequently lost consciousness and died. So, yung pangyayari pong yun is nagkaroon ng malaking impact sa public para pag-aralan pa po ng ibang mga scholars and scientists yung condition na hypertension. So, prior po to President Roosevelt's death, na-highlight po yung fact na noong unang panahon is wala pa pong effective anti-hypertensive na drugs. And then yung mga available na agents lang nun is mga therapy. Then, si sodium thiocyanate po yung unang gamot na na-invent for treatment na hypertension in the year 1900s. But due to toxicity po, hindi pinatigil siya ganun. Pinatigil yung pag-take ng gamot na yun kasi daw po yung side effects po niya is parang may toxicity po. So next po, causative agent pala. So yan, causative agent. Ayun Patrick, ano yung causative agent? Talagpasan ko. Yan, renal failure, hypothyroidism, CKD. Yan, sa causative agent po. Ayan, sa risk factors naman po, yung predisposing po, yung age, tapos sinama ko na din po yung sex. Bali po kasi yung risk of high blood pressure is tumataas po as we age. Tapos po, according po din sa nabasa ko is at the age of 60s po, yung high blood pressure po is most common sa mga lalaki. Then sa mga babae naman po, more likely, nade-develop po siya in the late 60s po. Ganon. Then diabetes, smoking, family history of cardiovascular diseases, kasi daw po si high blood pressure may tendency na mag-run din into the families. So, ayan po. Lastly, kapag impaired po si renal function, which is pag si kidney po is unable na to filter fluid and waste from the blood po, this could lead to an increase of fluid volume po in the blood and thus causing increase in BP po. Then, for precipitating po, isa sa pinakamalaking factor causing hypertension po is obesity. Kasi po, the more you weigh, the more blood you need to supply the need to supply oxygen and nutrients sa tissues natin. Physical inactive po, like kung wala po tayong exercise or sedentary po yung lifestyle natin, is malaking factor din siya. Dyslipidemia po, meaning elevated si LDL or low po si LDL. Dito na rin po pumapasok si unhealthy eating po natin, which is, too much salt, yun nga, nabanggit ko kanina. So, for the perpetrating naman po is lacking of knowledge with regards to the condition. Next po. Ayan, for the signs and symptoms naman po, so karamihan po sa mga tao na may hypertension is asymptomatic po at first. So, yung mga nandyan is headache po. Sa una po, si headache because, ayan, si headache. Kasi po si RBC po yung nag-carry ng oxygen. Dizziness po occurs due to low concentration of oxygen that reaches the brain. Chest pain po occurs due to decreased oxygen levels. Then blurred vision po or visual changes may occur later on because po sa too much constriction in the blood vessels sa mata natin. Then nosebleeds and shortness of breath po. Next, Patrick. Ay, ano nga pala, idadagdag ko lang pala, dun sa signs and symptoms po, kapag si hypertension po is left untreated, possible po na nag-progress siya into complication po sa iba't ibang organs like heart failure po, myocardial infarction, impaired vision or ineffective peripheral perfusion po, then renal failure. So, ayan, diagnostic test na. So, una po is urinalysis. Urinalysis, ayan, tama. Urinalysis. So, usually po, pine-perform po ito to check concentration of sodium in the urine. Blood chemistry po, next is, ayan, blood chemistry. So, ito pong test na to is ginagawa to determine the level of sodium and fat in the body. Then, si 12-lead ECG po, so kailangan po i-perform si ECG to rule out presence of cardiovascular damage. Then, si echocardiography naman po is to assess the presence of left ventricular hypertrophy po. So, sa kasi sa diagnostic ng hypertension, marami pa siyang other test na ginagawa gaya ng creatinine clearance, renin level, hemoglobin and hematocrit, which is included naman sa CBC. Then, BUN, creatinine, glucose. So, yan, mga yan, sina-check din siya. Serum potassium po, serum calcium, lipid panel, thyroid studies. Ayan, yung VMA, uric acid, urine steroids, intravenous pyelogram, kidney and renography, nuclear scan, expiratory urography, then CT scan. So yan, ayan po yung mga additional na test na ginagawa kapag pag nagda-diagnose or in order po para ma-determine si hypertension. So next po, sa medical management. So, ayan, sa medical management po is the goal of hypertensive treatment is to prevent complications and death by achieving and maintaining the arterial blood pressure at 40/90 mmHg or lower. So, yung medications po na nakalagay dyan is, ayan, tama. Ano pababa nga, Patri? Ayan, yan, medical management. So, sa pharmacologic therapy po, including anti-hypertensive drugs po. So, of course, kasi nga hypertension. So, ginagamit po si anti-hypertensive drugs for treating hypertension, decrease peripheral resistance, blood volume, or the strength and rate of myocardial contraction po. For complicated hypertension po, yung initial medications na nire-recommend is yung diuretics po and beta blockers. Then, si thiazide diuretics po, ayan, yan, nasa taas. Si thiazide diuretics po is dinidecrease niya si blood volume, renal blood flow, and cardiac output. Then, yung included po ng mga gamot, saka kay thiazide diuretics, yung chlorthalidone, fluorothiazide, hydrochlorothiazide, indapamide, meticlothiazide, metothalazone. Ayan. Then, sa beta blockers naman po, binablock po niya yung sympathetic nervous system to produce a slower heart rate and to lower blood pressure. Then, si ACE inhibitors naman po, ini-inhibit po niya si angiotensin 1 to angiotensin 2 through conversion po, also to lower yung peripheral resistance po. Then, yung si calcium channel blockers naman po, yung medication na to, including amlopidine, diltiazem, and others, is tumutulong po to relax the muscles and blood vessels para mag-slow si heart rate. So, ayan. So, additional po pala, sa stage 1 hypertension po, si thiazide diuretic po is nire-recommend for most angiotensin-converting enzyme 1, aldosterone receptor blocker, beta blocker, or calcium channel blocker is considered. So, ayan po, yung binibigay during stage 1 hypertension. Then, sa stage 2 hypertension naman po, yung two drugs combination na yung binibigay. Usually po, thiazide, tas diuretic, ay diuretic po and angiotensin converting enzyme 1 or beta blocker or yung calcium channel blocker po. So, ayan. Treatment. Ay, iba kasi yung nilagay ni Bon na treatment dyan. So, yun sa treatment po, a multi-pronged approach po including diet and lifestyle changes, medication, and exercise. So, sa nursing management naman po, next, Patrick. Patrick. Ayan, nursing management. Sa assessment po, the goal ng nursing management is to help advise, is to help to achieve normal blood pressure po through independent and dependent intervention. Sa assessment po, wait lang, di ko makita ang liit. Ayan, carefully. So, ayan, paiksin na lang natin yung assessment. So, assess the patient's health history, perform physical examination as appropriate. So, ayan, necessary yung mga yan. Check the retinas for possible organ damage. Laboratory tests are also taken to check target organ damage. The patient is on hypertensive medications na po. I-assess natin sa blood pressure. Then, complete history po, kailangan din i-obtain. Then, ayan, pay attention po sa rate, rhythm, and character of apical and peripheral pulses po. Next po, diagnosis. Ayan. Based on the assessment data, nursing diagnosis may include deficient knowledge regarding the relation between the treatment regimen and control of the disease process, non-compliance with the treatment regimen related to side effects of prescribed therapy. Next po, mayroon pa ba yan, Patrick? Patrick. Ayan, so additional ko lang sa diagnosis, pwede din po yung risk for activity intolerance related to imbalance between oxygen supply and demand, tas risk-prone health behavior related to condition requiring change in lifestyle, then imbalanced nutrition po related to excessive intake in relation to metabolic need as evidenced by reported or observed dysfunctional eating pattern. So, ito lang naman po yung mga possible na nursing diagnosis. Depende pa rin po sa case ni patient. Then, ineffective coping related to work overload and inadequate support system and for nutrition. So, ayan. Sa planning po, the major goals for the patient with hypertension includes understanding of the disease process and its treatment, participation in self-care program, absence of complications, BP within acceptable limits for individual, cardiovascular and systemic complications prevented or minimized, disease process prognosis, and treatment regimen understood, necessary lifestyle and behavioral changes po, then plan in place to meet needs after discharge. So, ayan. Patrick. Next. Ayan, additional po pala sa planning, yung nursing priorities po, maintain and enhance cardiovascular functioning, prevent complications, provide information about disease process, and then yung prognosis po and treatment regimen, then support active patient control of condition. So, for the intervention po, ang haba. The objective of nursing care for patients with hypertension focuses on lowering and controlling the blood pressure without adverse effect and without undue cost. To achieve these goals, the nurse's role is to support and educate the patient about the treatment regimen, including making lifestyle changes, taking medication as prescribed, and scheduling regular follow-up appointments with the patient's primary provider to monitor and progress or identify and treat any complications of disease or therapy. So, ayan. Then, encourage din natin si patient for the restriction of sodium and fat. Then, yun nga, yung sa, lifestyle changes. Like yung, physical activity po, ganun. Then, Patrick, tapos na intervention. Patrick, ayan, evaluation na. So, yan. At the end of the treatment regimen, the following are expected to be achieved. Ayan, reports knowledge of disease management sufficient to maintain adequate tissue perfusion, like maintains blood pressure at less than 140/90 with lifestyle changes. Ayan. Then adheres to self-care program like exercise regularly and measures the blood pressure routinely. So mahalaga din yung nagche-check talaga ng BP. Then has no complications such as reports no changes in vision, maintains pulse rate and rhythm, and respiratory rate within normal ranges, reports no dyspnea or edema, and demonstrates no motor speech or sensory deficits. So yan, exercise regularly, takes medication as prescribed. So ayan, yan lang yung mga kabilang din sa evaluation na kailangan natin i-check. So next po, ako. So ayan, medyo zoom ko lang, maliit kasi dito, phone lang po yung gamit ko. So ayan, so until now po, sabi ko nga kanina, si hypertension po is still uncertain about its pathophysiology po, kung saan nag-start ganun. But I will try po na i-discuss po siya sa inyo. So, in the pathophysiology po ni hypertension, there are a number of physiological mechanisms po involved in the maintenance of normal blood pressure, and their disarrangement po may play a part in the development of hypertension. So, in a normal circulation po, yung pressure po is transferred from the heart papunta sa blood natin every time po na si heart is nagko-contract. And then si pressure po, wini-wield po siya or na-exert po niya si blood as it flows through the blood vessels. So, si hypertension po, marami siyang causes, just like fever, ganun. So, yung babanggitin ko po is just some of the factors that are implicated as causes of hypertension. Then, yung others naman po is madidiscuss po sa flow dyan sa nilagay po ni Bonbon na pathophysiology. So, ayan. So, isa po sa dahilan kung bakit nagiging hypertensive ang isang tao, nagkakaroon ng hypertension ng isang tao is because increase po yung activity ni sympathetic nervous system. Dahil increase po yung activity ni sympathetic nervous system dahil mayroong dysfunction in the autonomic nervous system. So, ano po ba si sympathetic nervous system? Si sympathetic nervous system po is a part po siya ng autonomic nervous system, and isa po sa role niya is to regulate the heart rate and blood pressure. Kay sympathetic nervous system po, there are imbalances in several neurotransmitters and neuromodulators yung present sa kanya during development of hypertension. And with this po, directly or indirectly, nagko-contribute po ito into an increased release of noradrenaline. Ayan, noradrenaline papunta po sa postsynaptic targets of the sympathetic nerves. In terms naman po sa sodium chloride sensitive hypertensive subject, si sodium chloride din po is ini-increase po niya yung sympathetic nervous system activity, both directly and indirectly. So, ayan, baba naman tayo. So, another reason po, ay wala po yan dyan parang mababa. Ay, ito po pala yan sa may sa taas. Pero babanggitin ko na din. Si increased renal reabsorption po. So, another reason po is yun. Si increased renal absorption. Increase po yung reabsorption of sodium chloride and water, which is related po sa genetic variation naman. And genetic variation naman in which the kidneys handle sodium po. Then, increased RAAS activity. Yung RAAS po is renin, angiotensin, aldosterone system. So, increase po yung activity ni RAAS, leading to expansion of extracellular fluid po, and increased systemic vascular resistance. Bali po, si renin-angiotensin system ang pinaka-importante po sa endocrine system po natin na maaaring maka-apekto po sa pag-control ng blood pressure. Si renin po is secreted from juxtaglomerular apparatus of the kidney in response to glomerular underperfusion or a reduced salt intake po. And nire-release po talaga siya in response to stimulation from the sympathetic nervous system po. Si renin din po yung responsible for converting renin substrate or yung renin substrate to angiotensin 1. So ito pong inactive substance na ito is rapidly converted to angiotensin 2. Yung isa lang po yan by angiotensin converting enzyme or ACE po. So si angiotensin po is a potent vasoconstrictor and causes a rise in blood pressure. So in addition po dito, it also stimulates the release of aldosterone from the zona glomerulosa of the adrenal gland, which results po for further na pagtaas ni blood pressure related to sodium and water retention. So yun po yung sa increased RAAS activity. So sabi din po, yung nagsi-circulate naman daw po, renin-angiotensin system sa katawan natin is not directly responsible po kung bakit tumataas ang blood pressure po sa primary hypertension. Particularly daw po, ang dahilan is kaya daw po hypertensive ang patient is dahil po low yung levels of renin and angiotensin 2 po nila. Ayan, especially po sa mga elderly. And then yung drugs naman daw po na nagbo-block renin-angiotensin system is hindi daw po particularly effective, targeting yung function po niya. Yan. So last is yung the decreased vasodilation of arterioles po. So one of the last reason po is yung vascular endothelium po is vascular endothelium po is damaged because po decrease po yung vasodilation ni decrease po yung vasodilation ni arteriole. Sorry, nagugulan na din ako. Si vascular endothelial cells po, yung role po niya sa cardiovascular regulation po is through producing a number of potent local vasoactive agents, including po yung vasodilator molecule nitric oxide and vasoconstrictor peptide endothelin. So, yung ganito pong dysfunction in endothelium is mostly seen with primary hypertension or essential hypertension. So, increased systemic vascular resistance, increased vascular stiffness, and increased vascular responsiveness to stimuli are the central to the pathophysiology po of hypertension. So, as we all know po, gaya po na nabanggit po kanina, there are two types of hypertension. These are yung primary hypertension po or also known as essential hypertension, which is yun, nasa left side po. And then the other one po is yung secondary hypertension, which is placed on the right side. Bale, mag-start po muna tayo kay primary hypertension. Sorry, napuputol po. So, ayan, mag-start po muna tayo kay primary hypertension. The risk factors po na included kay primary hypertension is una po, smoking. Second is obesity, alcohol intake, stress, and sodium intake. So, constipation po is a non-smoker, especially po those of long-term smoker. Of course po, increase si BP and si heart rate, resulting in narrowing of its artery and their walls that could lead to blood clot. So may masamang effect po si blood clot that could affect our brain. And in worst case scenario po, it could lead to stroke. So yan, pupunta yan sa linya dyan. Ilagay ni Bo. So nangyayari po si blood clot more likely in hypertension po since si arteries po yung nagkikarry ng oxygen in our blood galing po sa puso natin at sa iba't ibang cells. Still, it can keep oxygen po ulit galing sa heart, lungs, or brain natin. Then, because po of hypertension, si blood clots po na namuo, doon po siya namuo sa arteries. Arteries natin, papunta at madadala po sa brain. Ayan. Resulting into blocking of blood flow. So, nangyayari po si stroke kapag si brain is deprived of oxygen and nutrients na. It causes brain cells to die. So, yan. So, yung mga blood vessels din po na damage caused by high blood pressure can narrow, rupture, or leak. So, yung mga manifestations po ni stroke includes, ayan, yung nasa baba pa, pa-include, pa-include tuloy. Pababa po. Part nasa baba, 3 kasi yan, ang haba. Ayan. So, yung mga manifestation po ni blood vessel, yung ni stroke, sabi ko nga is yun, weakness of one side of the body, unexpected dizziness, loss of vision, headache with no known cause, and loss of verbal understanding po. So the other high chances po that contribute to stroke includes those of the patient or person po who has heart disease, high cholesterol, diabetes, and high blood pressure. Ayan, makikita nyo dito sa gilid, right then yung naka-green. High blood pressure. For those who have this heart disease po, cannot provide sufficient blood and oxygen in the body, resulting in organ perfusion, confined to the brain, leading to cerebral ischemia or stroke. So, parang gaya din po yan ng sinabi ko kanina about stroke. So, ayan. Ayun yun, yung sinabi ko kanina. Then, high cholesterol po will develop, si pangalawa, si high cholesterol po will develop fats, and that fats po will be deposit sa blood vessels natin. And when there are too many fats na po sa blood vessels, ayan nga, Ayan, kung there are too many fats na po sa blood natin, ano pong mangyayari? So, ang mangyayari po, they cause fatty deposits to build up in the arteries, leading to atherosclerosis. Si atherosclerosis po meaning narrowing and hardening of the arteries, in which this greatly increases the risk of heart attacks and strokes. So, ayan po. So, ayan, diabetes. So, how can we correlate to diabetes and hypertension? So, in diabetes po, dinadamage niya si arteries and tinatarget po niya for hardening called atherosclerosis. Yun nga, sinabi ko kanina. Sinabi ko kanina, that can cause high blood pressure, which if not treated po, can lead to trouble including blood vessel damage, heart attack, and kidney failure. And kung si blood po is high with glucose naman po, ayan, si diabetes po yun kung si blood naman po is high with glucose, nagta-travel siya throughout the body din natin, then it can cause a widespread damage po, like sa blood vessels po, ganun. So, yung mga organ nga po na nabanggit ko has their, kanya-kanyang role in maintaining healthy blood pressure po. And if they experience po ng damage or impaired po sila, si blood pressure po is nag-rise. Then, nag-i-increase din po yung risk for complications. And then, ayan, high blood pressure. Nandiyan pa rin tayo sa right, yung sa baba. And then, si high blood pressure po, si high blood pressure po, of course, increase nga po siya, gaya po na sinabi ko kanina. Then, there is a high chance po for bleeding or hemorrhage. Ayan, in severe cases po, if left untreated. So, ayan, next, obesity po. Patrick, pataas. Pataas na po ulit. Patrick. Taas na. Patrick, tulog na eh. So, ayan po, next. Uy, taas, baba yan eh. Baba yan, yung taas. Yung kaunahan na.
Bakit? Yung kaunahan?
Yung taas niya.
Balilibog.
Tulog ka na eh.
Yan.
Ayan. So, ayan, next naman tayo. So, obesity. So, of course po, kung obese ka po and you're having unhealthy eating habits, again, this is a high chance po for developing cardiovascular diseases po. So, kung meron ka pong cardiovascular diseases, dito po papasok yung mga sinabi ko kanina na nauna. Then, activating renin, angiotensin, angiotensin nga. Angiotensin and aldosterone system, the sympathetic activity po, insulin resistance and leptin resistance, procongulatory activity and endothelial dysfunction po. So, dyan po siya pumapasok. Yung nasabi ko po kanina, nakaunahan. Then, next po, alcohol intake. Increase po si heart rate, increase si BP, then it can weaken the heart muscles po and you may experience an irregular heartbeat po. So, yan, stress. Yan. Of course po, stress is dramatic. Ayan, nakalagay dyan. Dramatic that can temporarily spikes the blood pressure. So, ang naisip ko po dyan habang inaaral ko yan, may paniniwala po kasi tayo, di ba, noon. Ay, kahit ngayon, may paniniwala po na pag sinabing galit ka, high blood ako, ang taas ng, parang ganun, kumukulo yung dugo ko sa'yo, ganun. So, yun yung naisip ko dyan. Ewan ko kung ba't nilagay ni Bonbon yan. So, yung kasunod po ng stress is yung sa sodium intake po. Yung last po yan, sodium intake in which our body holds onto the water. Ayan, hold on to water. So, in reducing sodium intake po, nakakatulong siya in lowering blood pressure, lalo na po sa mga patient or tao na may matataas or beyond the borderline po yung high blood pressure. So, dito po pumapasok yung nutrition therapy or intervention po dito po yung therapy or intervention papasok para sa magiging eating style ni patient. So, meron po tayong additional ko lang po dyan, meron po tayong tinatawag na DASH diet. So, yung DASH diet po stands for Dietary Approaches to Stop Hypertension. So, ginawa po itong approach na ito to lower the blood pressure po without getting medications. So dito po sa DASH diet po mostly included po yung mga less sodium foods, veggies and others po containing potassium, calcium and magnesium. So yun po yung ni-recommend sa DASH diet. Which is nakakatulong po to lower the blood pressure. So ayan. Punta na po tayo kay secondary hypertension. So yung manifestations po niya may include nosebleed po, dizziness, and headaches po, caused by the blood clots or some of these underlying disease po na nabanggit ko kanina. So, ayan, parang nabanggit ko na rin kasi yan, yung mga blocking blood flow, blood clots, sa stroke, parang nabanggit ko na po kasi yan. So, punta naman tayo dito sa heart. Kasi dito po sa secondary hypertension, nasabi ko na kanina si blood clots sa arteries, then yung sa blocking of blood flow. So, kung ganun yung nangyayari, ayun nga, nagkakaroon ng nosebleed, headache, tsaka dizziness, si patient, or yung taong hypertensive. Then, yan, punta tayo sa heart. So, ayan. Sa nakalagay po kasi dyan, ayan, sa right side na. Ayan, wait lang, palakayin natin. So, ayan po, sa kay heart po, I'm not sure po kung dito po pumapasok si pulmonary hypertension po. That's why may difficulty of breathing. Ayan, difficulty of breathing, DOP. But let's see po kung according po kasi dyan, si heart is having a hard time to pump blood daw po through the body. Heart muscles become thick and too large to pump to enough to resulting to difficulty breathing. So, sinamili ko lang yung tatlong yan. So, yan yun. Difficulty breathing. So, si pulmonary hypertension po, word itself na rin, meaning, hypertension in the lungs. So, kaya daw po ito nangyayari is because yung right side po ng puso natin is having trouble pushing blood flow through the lungs, and hindi po si blood flow nakakarating or nadadala sa left side po ni heart tsaka po sa left side ng katawan natin. So, according po doon sa nabasa ko, binibigyan daw po ng struggle or binibigyan ng struggle sa right side right side of the heart to strive po, which is so ayan, sorry na po po.
Nawawala.
Opo sir, sorry po kasi po gawa po nito, hindi ko po makita yung ano, lumiliit po yung ano, PPT sa akin. So, ayan. Ayun po sa ano, sa pulmonary hypertension daw po sa heart. Then balik naman po tayo dito sa left. May mahaba po kasing line or arrow na nilagay diyan pababa. So ayan, may arrow doon sa pinakagilid, may makikita kayong arrow na pinaka pababa. Patrick, pababa. And deep, ano, next pa Pat. Yan, yan. So, kung mababasa niyo po sa last slide dyan, nakalagay po dyan yung mga possible organs po na maaaring maapektuhan po once you have hypertension. So, arteries, heart, kidneys, brain, and blood vessels po. Each time the heart beats pressure, ayan, contracts and relaxes, this is created inside the arteries po, and if the arteries po are impaired, its function, decrease po yung flow of blood and oxygen papunta kay heart, resulting po to chest pain. So ayan, nakalagay. Then each heartbeat din po, as the blood is pumped from the heart into the blood vessels, the size and elasticity po of the artery walls affects the blood pressure. So for the organ targeting naman po na yung sa heart, ayan. For the organ targeting po the heart, yung CHR po and BP is elevated. Therefore po, this increase the risk for developing a hypertension. Kay kidneys naman po, kapag impaired yung capacity ni kidney to excrete sodium in response to elevated blood pressure, elevated blood pressure po, could be a major contributor po to hypertension. Then lastly po, sa brain po, yun, white blood cells, WBC kasi nakalagay dyan. WBC, which once trapped, could result to an inflammation po for the various inflammatory markers associated with hypertension and its complications po according po sa nabasa. Ayan, and its complications. So, ayan. Ano yan? Brain construct. Ayan. So, according po dun sa ano po, sa ay, ano yan? Ba't nawawala? So, according po dun sa nabasa ko po, kasama po si high sensitive, high sensitive C-reactive protein po, si HSCRP, interleukin 6, TNF alpha or tumor necrosis factor alpha po, and white blood cells. Bali daw po si elevated white blood cells in hypertension can cause a chronic low-grade inflammation po that alters the endothelial function po, affecting the nitric oxide and prostacyclin production, resulting po to loss of vasodilator, antithrombic, and anti-rhogenic properties of the vascular endothelium. And then yung possible other reason daw po is because yung inflammation daw po is tumutulong in initiation and development of hypertension po via pro-inflammatory actions po of mediators such as adhesion molecules po, chemokines, growth factors, heat shock proteins po, endothelin 1, and angiotensin po. So, ayun po yung sa, ano po, hypertension. So, pathophysiology po ni hypertension. So, yun po. So, question number 1 po. A 50
Sige, read the question.
Ayan. A 59-year-old man with a known history of hypertension presents to you for evaluation because he says he has been having frontal headaches and blurred vision during the past few days. When asked, he does not note any focal weakness, numbness, chest pain, shortness of breath, palpitations, or recent illicit drug use. He tells you that he has been compliant with his antihypertensive medications that he takes at home. So, ayan yung mga gamot. Hydrochlorothiazide, lisinopril, and metoprolol. And he adds that he took these medications today. On today's visit, his blood pressure is 200 over 130 mmHg, and his pulse is 90 beats per minute. General physical examination is unremarkable, and neurologic examination is non-focal. You perform a fundoscopic examination. What would be the best next step in the management of this patient's blood pressure? So A po, no interruptions. B, additional dose of current. C, antihypertensive medication. D, intravenous labetalol. Yan, labetalol.
Okay, so the question is a 59-year-old man with a known history of hypertension presents to you for evaluation because he says he has been having frontal headaches and blurred vision during the past few days. When asked, he does not note any low focal weakness, numbness, chest pain, shortness of breath, palpitations, or recent illicit drug use. He tells you that he has been compliant with his metoprolol and he adds that he took this medication today. On today's visit, his blood pressure is 200 over 130. What type of hypertension? Primary, secondary? Hmm. And his pulse is 90 beats per minute. Generally, physical examination is unremarkable, and neurologic examination is non-focal. You perform a fundoscopic examination. What would be the best step in the management of this patient's blood pressure? A. No interruptions. B. Additional dose of current. C. Antihypertensive medications. D. Intravenous labetalol. What's the correct answer?
May mukha na lang nagagalit.
The answer. This time, I'll call you to rationalize your answer, ha? Tingnan natin kung nakuha niyo na on how to rationalize.
Yung sa akin,
Pick one. Okay, so let's have Redondo. Why D?
Sir, ano lang, tingin ko lang po, sir, ah. Kasi, sir, kaya pinili ko yung intravenous labetalol, bukod po dun sa, tinitreat niya yung blood pressure, kasi po, IV, so intravenous, mas mabilis po yung action. So, possibly po, bumaba po agad yung BP. Kasi yung parang tinik niya po anti-hypertensive medications, oral po siguro yun. Yun lang, sir. Tingin ko lang.
Okay, Erdaw, YA. Erdaw. A. Okay, si Erdaw, bakit A? Wala?
Ano po ulit?
Narinig niyo pa ba ako?
Sorry.
YA, rationalize your answer, YA.
Sir,
Yes.
sir, hindi po talaga A yung
Rationalize by
sagot
A
ko.
is your
Letter D po
answer.
talaga yon.
O, ano sagot mo? Ano sagot mo, Be?
Sir, hindi po letter A yung sagot ko. Letter D.
O, ba't A ang nandito eh? Okay, sige. Para di magtagal. Okay. So, since nag-start tayo 10, 11, 12, 1, technically 3 hours na talaga naman tayo. For the rest of the group, yung si Dalus na lang at si Parabuwak ang wala, you would be reporting on Wednesday bago ako. Okay? So, we'll just finish the questions here. Okay? So, the question is, a 59-year-old, okay, pumunta daw sa, sa inyo to have checked. So upon checking, 200 over 130. So category, ano category ng hypertension 2? Hypertension, sinagot ko na pala. Hypertension 2. Ito, okay? Now, ano ang initially mo gagawin with a patient with this particular blood pressure? No interruptions. B, additional dose of current. C, antihypertensive medications, D, intravenous labetalol. Now, we all know for a fact that the patient is has emerging problem. And this is not just simply an emerging problem, but an emergent problem. So, being a nurse, hindi pwedeng no interruptions. Ibig sabihin, wala kang gagawin. Okay? So, letter A is not a good choice. Now, additional dose of the current, okay, it can be a good choice only if you know the half-life of the medications being given or has been given. However, if despite of giving the said medications, pero masyado pa rin mataas ito, instead of giving additional dose, let's give a different antihypertensive medications. Okay? Now, antihypertensive medications. Okay, so despite of this, antihypertensive medications and labetalol would be a good options to choose from. Why? Because you are not preparing to using the same medications na hindi nga naging effective eh, di ba? And no interruptions is not a good choice kasi wala kang gagawin. You'd let the patient lang. So what's the purpose of coming in pa kung di naman din tutulungan? So antihypertensive medications and intravenous labetalol. Between the two, when you choose, never choose an answer that is vague. Never choose an answer that is not specific. So among the two, the correct answer is letter D because it specifies which medication you may give, which is labetalol. Okay? However, if among the choices, may choices na about assessment, okay? The first thing you need to do is to assess. Never give medications because giving medications is not your action. It is a dependent function. Okay? So intravenous labetalol, why intravenous? Because nag-oral na siya. It went ineffective. So it would be intravenous kasi masyado nung mataas yung 200. It may cause for the aneurysm if meron siya aneurysm. So the correct answer is letter D. Did you get it?
Yes po.
Okay. Next question.
So, a 65-year-old man with a history of hypertension presents to you complaining of intermittently occurring chest palpitations associated with some lightheadedness for past 2 weeks. On examination, his vitals are BP 150/80, HR 120 beats per minute, and the regular respiratory rate is 20 breaths per minute. Temperature is 97.5 degrees Fahrenheit. After you feel his pulse, you bring electrocardiogram. Which of the following will also help to control the patient with hypertension? So A. Metoprolol, B. Hydrochlorotazidine, C. Prazosin,
A nawawala. A answer. O sige, para mabilis tayo matapos. Okay, so basically, the question here is that you have a hypertension, 150/80. This is category 1, diba? But the problem here is that there is an exceeding beats or exceeding pulse rate of your patient. So you are not only attending for the high blood pressure, but as well as for the tachycardia. Okay? So the main question is that which medication would help lower the hypertension and as well as attend the increased heart rate. So let's have this one. Ano ang digoxin? Anong classification ng digoxin? What kind of medication is this? Anyone? What kind of medication is digoxin? Anyone? What type of medication is digoxin?
Heart problem, sir. Control lang. Control heart.
Digoxin is ano?
Ano, sir? Control heart problem.
Ano siya? Hindi, what type of medication is this?
Ano, sir? Cardiac glycoside.
Okay, so this is a cardiac glycosides. Okay? A cardiac glycosides is responsible to what? To what? Ano ginagawa ng cardiac glycoside? Anyone? 5, 4, 3, 2, 1.
Heartbeat, sir.
Ano po?
It is, okay,
Ano po?
it corrects arrhythmias.
Yes.
Arrhythmias that is high. So basically, pinapababa niya ang iyong heart rate. So if kung pinapababa niya yung heart rate, then digoxin is a good option to choose too. Tama? However, does digoxin, sige, i-retain muna natin digoxin. Yung prazosin, what type of medication? Prazosin.
Ano, sir? Treat to high blood pressure.
Treat high blood pressure. So basically, it is an antihypertensive medication. So it's a good option also. However, i-keep muna natin. Hydrochlorothiazide, what kind of medication?
Diuretics po.
Okay. So, isa-isahin natin. Ang kailangan nyong balikan dito is your anatomy and physiology and basically your pharmacology. Specifically, pharmacology talaga. Now, we all know for a fact na hydrochlorothiazide is a diuretic. The reason why we do give diuretics, para umihi ang pasyente. Kapag umihi ang pasyente, it will decrease the blood volume because of limiting the fluid inside the body of the patient. Okay? However, it will only address blood pressure, but never the heart rate. So hydrochlorothiazide is not a good option. Eliminate. Okay? Prazosin. Prazosin is also an antihypertensive medication, basically an alpha blocker. Pag sinabi natin alpha, saan nga ulit nakikita ang alpha cells? Anatomy physiology, saan nakikita ang mga alpha cells? Ala. Ang alpha cells, they are basically located in your blood vessels. In your blood vessels. Sabay-sabay kayo na-google, no? Kaya pancreas ang nakuha nyo, ano? Sabay-sabay, kaya endo, no? Ang alpha cells, okay, they are, if we are in the context of blood pressure and cardiovascular, they are highly evident or highly concentrated sa inyong blood vessels. So basically, it dilates your blood vessels. Okay? When it dilates your blood vessels, it could have an impact to your blood pressure. Okay? And when the blood vessels creates an impact to your blood pressure, okay, since the blood vessels are connected to your heart, okay, interconnected, should I say, then it may have an impact to your heart. Tama ba? So it's a good option. Let's retain prazosin. Let's talk about now digoxin. The digoxin or lanoxin, it is a cardiac glycoside, which is the primary purpose is to lower your cardiac rate. Okay? So the primary purpose of this is to lower your cardiac contractility. Okay? through glycosides. Okay, but basically it will not affect your hypertension crisis or your hypertension state. Only your cardiac aspect. So if that's the case, then okay, it's not a good option. So the only remaining option is the prazosin and the metoprolol. So both are antihypertension. The difference is that yung prazosin, it's alpha blockers. Saan nga ulit ang alpha cells? Cardiovascular context. Kakasabi ko lang ang kanina, vessels. Blood vessels. Ang metoprolol is an antihypertensive beta blocker. So if it's a beta blocker, ang kanyang inaayos specifically is your what? Is your cardiac contractility also. But specifically, beta cells. Okay? Now, since yung beta cells mo, nakiliti na, makikiliti niya rin yung alpha cells since interconnected siya. Eh, sir, gano'n naman pala eh. Naggalaw ang beta cells, magagalaw din ang alpha cells. So therefore, it would result to beta cells, mag-decrease ang cardiac heart rate, alpha cells, mag-decrease ang kanyang blood pressure. Tama? So bababa ang kanyang blood pressure, tama? Now, sa process, okay, makikiliti naman, sir, yung alpha cells eh. So bakit hindi makikiliti ang beta cells? Why? Because we all know for a fact that, okay, larger organ may affect smaller organ. Larger part may affect the lower part. So dahil heart ang may mas malaki kumpara sa blood vessels, yung heart ang kailangan natin unang ma-attend. Because when heart is corrected, the blood pressure follows. Okay? If the blood vessels corrected, yung heart problem will not be technically answered directly. Magtatagal pa. So the correct answer is metoprolol because it directly answers the heart origin, which is the beta cells. Okay? Next question, last.
A client is wearing a continuous cardiac monitor which begins to sound its alarm. A nurse sees no electrocardiogram complexes on the screen. The first action of the nurse is to A. Check the client status and lead placement. B. Press the recorder button on the electrocardiogram console. C. Call the physician. D. Call a code blue.
And what's the correct answer? Okay, so the correct answer is letter A. Okay? Hindi to katulad ng mga nakikita natin sa movie na kapag nagpa-flatline, nagko-code blue agad. Because there's no such thing as flatline pagdating sa actual na buhay. Why? You never experience a flatline and then you call for a code blue revival. Because the line will only be flattened or magkakaroon ka ng flatline kapag wala ng electric impulses, not from the body, but from the electrical sources. So, ibig sabihin na bunot siya. Doon na siya magka-flatline hanggang magsara. So, mali yung nakikita natin sa mga movie or sa mga TV series. Okay, that's wrong. Call the physician. It's a wrong choice. Why? It's a wrong choice because when you call the physician would ask you what happened. Okay? The physician would ask you, what did you do? So, ano yung sasagot mo? Basta dok, tumawag na lang ako kasi kailangan. It's a wrong choice. So, it is a good choice, but there are best options to choose from pa. But not to call the physician. Press the recorder button on the electrocardiogram console. Is this a good choice? It's not a good choice. Why would you record a flat line? What the use for? Okay? So the correct answer is check the client status and lead placement. So in a scenario like this, okay, in a question like this, always choose the answer that would lead you to assess first. you need to make an assessment first before you make relay or before you make any referral. Because in every referral, there are questions that need to be answered. And those answers will be coming from your assessment. So the best answer here is assess. Okay? Okay? Kasi baka mamaya tumawag ka sa doktor, ay, Doc, hindi lang po pala nakalagay yung lead ng ayos. O, this, mukha tayong eng-eng doon. Okay? So the first thing you need to do is to assess. And upon assessment, kapag may nakita ko walang problema, you try to see what you can do. Okay? After which, that's the time you may call the doctor. For you to tell the doctor that the machine shows particular electrocardiogram of this, I have elevated the patient, blah, blah, blah. Still, the cardiogram is showing the same. So, yun na tamang referral. Okay? Now, again, in the benefit of our time, it's 1:30 already. It's almost 1:30 already. I cannot hold of you much. Si Ria kasi, pak na pak yung reporting. Okay? Sisihin niyo si Ria. On Wednesday, Dalus and Parabuak, you are to report first bago ako. Okay? So you continue your reporting of your group, of the group. Okay? So I'll see you on Wednesday. Okay. So, okay. So, hanggang dito na lang kasi I'll be attending, okay lang, Dia, joke lang yun. I have a work pa kasi to attend to after, by 1:45. So, let's meet on Wednesday. Should you have any questions, chat nyo ulit ako and I'll try to answer. Okay?
Sige po, sir.
So, that's all. Thank you.
Sige po, sir.
Thank you. See you on Wednesday. Bye. Hi, Miss Pere. I have received already the PDF. Thank you. O, kain na kayo.